We are here because nurses are not just healers, we're warriors. This is the Bedside Rebel. And today I am diving into yet another case of nurse abuse. And I'll be going back and finding articles because this happens way too often. And I've decided that I was going to use this platform to document all the nurse abuse that has, at least the ones that have been reported. And in this case, this is a case of a male nurse who was attacked back in September of 2023 at the Rhode Island Hospital. Now, yes, this was a male nurse. And so it's not, I just wanted to bring this case because it's not just the female nurse. It's all nurses. It's our healthcare workers who are under attack and unprotected. The female nurses are a little bit more vulnerable, but that's not necessarily true because anyone can be caught off guard. Okay? And in this case, this was a 53-year-old male, Scott Amaral, was attacked by 37-year-old George Bauer. Why? He was upset over his phone privileges. And I mentioned before that many nurses are verbally abused and sometimes have things thrown at them. Patients are yelling at them, and this type of abuse goes unchecked. And when the abuse escalates to physical abuse, there's no accountability. He attacked the nurse. George Bauer attacked the male nurse when he came into his room to check on him. A lot of things about this case were not disclosed because of HIPAA, patient confidentiality. Now, it's ironic that we do have HIPAA laws to protect the patient. Where are the laws to protect our nurses? Come to find out, this patient who attacked a nurse had previously violated bail from a previous assault charge on a woman in North Providence. How do you make sense of this all? How do you make sense of this? And there was videotape. This actual incident had some videotape. I've been looking for what happened in this case, and I haven't been able to find anything. So if you know anything more about what happened in this case, do drop a comment down below. But what's interesting is that as I did some research, I found this. This is on channel WJAR, NBC News. Wrote up a little piece, a story that said that a former inpatient psychiatric nurse and nursing professor at UMass Dartmouth, Jerry Lynn Boyden, says the incident likely happened at a change of shift time when patients can become more escalated with new people. Boyden says when a patient acts out violently, they can understand why, and pressing charges isn't typically something nurses go right to. When NBC 10 asked her about security in the hospital, especially in psychiatric units, Jerry Lynn Boyden responded, "That isn't really conducive to the milieu of psychiatric care to have security right there all the time. So it's really a matter of staff being able to recognize when something is escalating and get them to the floor to help," Boyden said. I'm sorry, but how arrogant and how thoughtless this comment is, I have to say. And to have, this is a nursing professor, and I don't know, they work the floor, and I don't know why administrators are so thoughtless. But in one sentence, she says that it's common for patients, psychiatric patients, to be agitated during change of shifts. And in the next sentence, she says, well, we leave it up to the nurse to determine whether or not they need help. Or whether the situation, I'm sorry, not whether they need help, but whether the situation is escalating and to call for help. When you know there's a potential, right? How do you mitigate risk? For all my risk assessment people out there, my risk mitigation people out there, how do you mitigate risk? You know what the risk is, and then you do something to prevent it. That's what risk assessments are for, and that's what non-conformances are for, and that's what corrective actions are for, right? Now, this administrator, I'm going to call her because she's a professor and a former inpatient psychiatric nurse, which means that she's no longer working on the floor. She's aware that there's a risk. What was done to mitigate the risk? Wouldn't it be prudent to at least, at minimum, have security on the floor during change of shift? Because you know that there's a risk. You know that there's a chance for escalation during change of shift. And if you've worked on the floor as a nurse, you also know that change of shifts are the most chaotic times when nurses are struggling to give report to the oncoming shift, finish up their charting, and most times the nursing units are understaffed. Which means that I don't know what the staffing numbers are for psychiatric floors because I have not worked psychiatric units, but I have worked the med-surg units, and normally there's one nurse for 8 patients. Try running back and forth to 8 patient rooms while you have the next shift in a room listening to report that has been taped, because most times report is not done face to face. Report is done when the next shift comes in. They are in a room, report has been taped, and that shift is not yet available. You have 8 patients. You go into a room, a patient is irate, you turn around to leave, and they attack you. When should you call? When should you have called for help? And nurses know that when patients have bad behaviors, such as throwing things, they may get a verbal warning, maybe. But most times, anything more than that is overlooked. So when should the nurse report? When do the administrators take accountability for the security that they needed? You are on a psychiatric unit where most likely, by no fault of the patient, because they are also mentally ill, right? They are most likely sometimes violent, reactive, and may have uncontrolled behaviors. And for her to say to me, it's not conducive to their, I'm going to read you her words exactly. Oh yeah, that isn't really conducive to the milieu of psychiatric care. But explain something to me. Doesn't psychiatric care include safety, the safety of your nurse and the safety of your patient? Because sometimes the patient can be inclined to even harm themselves. So with the nurse having 8 patients, how do you suppose that she should mitigate that when she's in a room with another patient if the patient harms themselves? Do you understand what I'm saying? So the nurse to patient ratios are outrageous and impossible. And unsafe. And to top it off, the administrators know the risk and they do nothing about it. And to just, openly state, yes, I know that there's a risk at change of shift, but, we leave it up to the nurse to recognize when something is escalating. And of course, if I'm in the room with a patient as a nurse, and I realize something is escalating, the first thing I'm going to do is try to get away, right? What happens when the patient jumps you? When should you call? Are there emergency, emergency bells, code red bells in the room? Something that the nurse can press. What are the safety measures? We can't just put this all on the nurse. And I want to read you, it was interesting because there was one comment on this conversation, and I was reading this and I was just dumbfounded. I was just like, she said what? She said that it was the nurse's fault, that the nurse should have known to call for help. Do you understand why nurses are leaving the profession in droves? For those of you who are listening who are not nurses, how can you tell me that it's my fault that you knew the risk and did nothing about it, but then I should have known better? Shifting blame here is not my goal, right? Because shifting the blame back and forth is not going to fix the problem. But if you know the risk, then do something about it. And I want to just read a quick statement, a quick response to this article that I would imagine it's a nurse that wrote this. Someone says, wow, this Miss Boyden needs to wake up and instead of making excuses, come up with a way to protect our nurses from situations like these. Hopefully, no other nurse or family has to suffer what this nurse and his family is going through. This is unacceptable. These hospitals need to protect their staff so they can care for their patients without fear of getting hurt or worse. My daughter works in this profession and was attacked a couple weeks ago. Hospitals need to step up, and remarks like Ms. Boyden made just show how ignorant they pretend to be to cover up serious instances like these. Do better. And this was back in 2023. We are now in 2025. And in the last month, we've had 3 more serious attacks. One not far from me, where this 67-year-old nurse will probably lose her eyesight in both eyes. It's bad enough that nurses can't even retire because the pay is not adequate. So nurses are working until they're 67, maybe even 70. At this point in her life, this 67-year-old nurse should have been retired and enjoying her vacations, traveling the world. But instead, she was at the hospital to take care of this patient, who then turned around and attacked her. We keep saying something needs to be done, do better. And each time, there's some administrator that comes back out and there's blame shifting. As if it's the nurse's responsibility to come to work and make sure that the workplace is safe, as well as do her job and handle 8 patients during her shift or his shift. Something needs to be done, not just something. Nurse to patient ratios need to be addressed. Security in hospitals need to be addressed. This administrator just as well said that she knows that there are issues with patient aggression during change of shifts, when nurses are the most scattered between, coming on, nurses are coming on and leaving. You know the risk. So if it just happens at somebody else's hospital, then it's not your problem. Or, that happened there, right? Then we can say that happened there. That doesn't happen here until it happens here. Nurses are leaving the profession in droves. I think I read, let me check. There are expected to be around 193,100 openings for registered nurses each year through 2032. In 2023, the data reveals 100,000 nurses left the workforce during the pandemic, and by 2027, almost 900,000, or almost 1/5 of the 4.5 million registered nurses, intend to leave the workforce. And you want to know what's ironic about that? We are the backbone of the healthcare system. The doctors, the nurses, not the managed care companies, not the administrators. The hospitals don't run without us. We deserve better. So you all need to start doing better. This is unacceptable. That response by that administrator, by the floor nurse turned administrator, that response was insensitive and unacceptable. Stop the blame shifting. Stop leaving it to your nurses who are overworked, understaffed, to keep your facilities paid while you line your pockets and that of the managed care companies. I'm sure you can afford to hire security. Take some of the CEO bonuses and hire security. Well, I don't think today there's not much else to say about this. Drop me a comment down below. Share this. Share this if you support nurses. Write a comment. Let me know what you think. I am going to be posting, maybe daily. I'm looking for and finding all the nurse attacks. I wanna document them in one place because it has to stop. They have to stop turning a blind eye. No pun intended, because now we have a nurse here in Florida losing her eyesight because of this lack of accountability. Fight for those who fight for you. For nurses, for justice. The bedside rebel is out.